The pathway for patients to be admitted into the emergency medical department of Muhimbili National Hospital comes by referral either through GPs, other clinics or other hospitals. The only exception is if people have their own insurance or if they pay cash. The exception to all of this is trauma. So these patients can arrive sometimes by the scarcely resourced ambulance service, but more usually with police, by taxi, or even more common, Good Samaritans. Marwa, the nurse manager in ED, took us for a tour as a patient would flow through the ED. So they see around 200 patients a day. 40% of them are covered by national insurance. And I guess one of the good schemes they have in the country is that employees actually have national health insurance provided by the government, which also includes up to 5 family members for them. The emergency medical department in Muhimbili was launched in 2010. Computers and the software that go with ED was only introduced in 2015. Although there's no real focus on KPIs or measures at the moment, the team do have a real commitment to quality improvement, and it's just a matter of trying to get some consistency throughout the hospital. Offsetting the flow of public patients, private treatment rooms are made available for those patients who can pay cash or even VIPs. So, for example, a few years ago, one of Obama's bodyguards got the VIP treatment and was seen here. As we moved through the ED, we came to an area where a lot of the teaching and study was conducted for and by the junior medical staff. So that area to the right-hand side is what's normally used for mass casualties. Paediatrics make up about 20% of the patient population at Muhimbili, and here they're knocking out some walls to create greater capacity to treat them. About 60% of patients to ED don't have the money to pay for their treatment, and about 50% of the patient population are referred to social work to progress their care. Recent good news for the hospital was the ability to build a new extension, 70% of which was funded by Muhimbili National Hospital and 30% by the Abbott Fund, which we'll talk about in another segment. We capped off our tour by a look at the supply room for ED, and the one item that couldn't be kept there with everything else and had to be hidden in a separate room was the supply of sugar. Such is the high demand for it.
I think the big picture needs to be continuity, to develop a relationship with between hospitals and to keep that relationship going, so that you understand the dynamics and the challenges that each other are facing, and so you can support each other through those times. I think a lot of what has happened here, especially from the nursing side, is that people came for short times and then they would set something up, some program up, and then they'd leave. So they didn't get local ownership or buy-in, and those programs didn't really work. From my perspective of being here for now more than 1 year, I understand those challenges. I understand the dynamics and why the challenges are the way they are. And so hopefully that helps me to be more productive in trying to solve some of the challenges. So I think continuity, like developing a strong relationship maybe with one place, is really important, and also asking and listening to the developing country hospitals, what are their needs, not just putting in place things that you think they might need, but actually listening to them and asking what are their requirements and how can you help them.
This is a very impressive place, I think, and the people are very impressive. They may have some limited resources. They've got incredible humility about where they're at, so they're seeking help. And in many ways they've achieved a lot on their own without help, I think. Clearly they've got their own initiative, they're highly motivated, they're very enthusiastic. So our challenge is to provide them something to augment that somehow and to support them in that.
So for me the most outstanding feature of today was the fact how proud these people are of what they've achieved in a fairly resource-poor environment, and especially the level of patient care they provide, which I think is absolutely phenomenal. It's high class, it's world-class care, but with very limited resources. And also they provide a service not only for Dar es Salaam or for Tanzania for that matter, but also for East Africa. So they've had some patients being transferred from the Comoro Islands. The president of the island was transferred to this hospital, which is a public hospital, because it's considered to be the best hospital in the region. And I think that's something that's amazingly wonderful to see how they've accomplished that, and where they can go.